Hi, Leah.
Hi, Kamna.
How are you?
I'm good. It's summer, middle of summer today, midpoint.
Yeah.
Yeah. What do you
Are
think
you
about
ready?
that?
Today has been a gorgeous day. I wish more days were like this. It's perfect.
A little cold. I had my heat on in the car this morning.
Are you kidding?
No, I'm not kidding. Just for reference, it was 55. So
Yeah,
when I
that
was
is
in
cold.
the car, it
Honestly,
was
that is cold.
55.
Yeah.
Okay.
Um, well,
Justified.
today we have a guest and I'm super excited to talk to her and ask her all things physical therapy related. We have Dr. Caitlin, say your last name.
Goggin.
Goggin. She's a physical therapist and she earned her bachelor's of science in exercise science at the University of Mount Union in 2014 and her doctorate of physical therapy from Cleveland State University in 2017. She is an impact trained physical therapist since
Oh, I have
2018.
questions on that. Go on. Sorry.
Yes, committed to concussion and vestibular management. And in 2021, 19 was my year, not hers. In 2021, she became a certified running gait analyst and uses a system approach to breaking down the movements runners need. That's fascinating too.
Yeah.
Lastly, she became certified in the selective functional movement assessment in 2023, which logically breaks down dysfunctional movement patterns in a structured, repeatable assessment. In her free time, Caitlin enjoys spending time with her family and friends and being active, whether it's biking, hiking, or running. And fun fact, she just ran her second half marathon and placed as the second female overall.
Good for
Congratulations.
you.
Thank you.
Where did you run that at? Or what run was it?
It was a half marathon in Fairport Harbor, Ohio, on the lake.
Oh, was it a beautiful run too
It
then?
was gorgeous and the weather was perfect and it was all hands on deck and it was made for a personal record of mine. So
You.
How long did
thank
it
you.
take you to run that?
An hour and 36 minutes. So
Are
about
you
7 minutes
kidding?
and 23 seconds per mile.
Oh my God, you guys can't see my jaw, but good for you. Wow.
I can't even run a mile. So to me, that's so impressive. So
Thank you.
impressive.
Wow. Okay, I have just a side note. What are your favorite running shoes? Brand?
I like to wear Nikes, but
Really?
it's very controversial.
Yeah.
But a physical therapist can help you with finding the correct shoe for you too. Just a little plug there.
Okay.
But we all have different foot postures and different running postures and ways that we move our body. So it's not to say that one running shoe is the best for everybody.
Okay. Your personal style is Nike.
Nike, yes,
Oh, so a physical therapist can help with that?
they can.
Okay. I'm all
I
over
had
the
no
place
idea.
already. So you start as Kamna because I'm already like ADHD going in a million directions.
I'm the same way because once she gave her intro, it was like, oh my gosh, so many questions to ask. Okay, well, let's start from the beginning. Tell us a little bit about how you got into being a physical therapist and you're a doctor of physical therapy. What does that mean
Hmm.
specifically?
Yeah, so I got into physical therapy. I knew I wanted to do something in the healthcare related field, but I wasn't exactly sure what I wanted to do. I went to Mount Union and I was running cross country and track there. I ended up getting injured in track and needing physical therapy myself. So I came home to my little town of Manaway and I saw the physical therapist here and she asked me what my plans were for the summer. And I said, running, training, gonna work a little bit. She said, come spend some time here. And I said, okay, great. So I spent a few days with her, hung out, saw what physical therapists were doing. And I was like, yeah, I love it. They get to spend so much time with their patients. They help patients with so many things. Like, I'll do that. So then I just kept pursuing physical therapy, went to grad school, got my doctorate in 2017, and went from there.
Wow. Okay, so do all physical therapists need a doctorate?
So now they do, as of 2016, all physical
Oh.
therapists have to have a doctorate.
Oh,
Originally, it started where you would get a bachelor's degree in something science related and then get a certificate in physical therapy. And then it progressed to a master's degree, and now it's a doctorate. So as of 2016, every physical therapist has to have a doctorate when you graduate school as an entry level
So
PT.
there's some that are like quote unquote grandfathered in.
Yes.
how
Gotcha.
many years does that take to get a doctorate?
So it takes 7 years of school total. You do 4 years getting a bachelor's degree and then 3 years of a graduate program.
Wow.
Wow.
Yes.
Wow.
So you really know your stuff.
It's a commitment, but they changed it to a doctorate degree because now we have what's called direct access. So patients can actually come see a physical therapist first without even going to see their primary care provider or another physician, which I think a lot of people don't know.
Oh.
So if you just have low back pain from sitting all day at your desk, or you sprain your ankle while you're out, walking or running, you can just call up your local physical therapy office and go straight to see a physical therapist. So they transitioned to that doctorate so that we have a lot more of that information and knowledge to screen our patients appropriately. Are they a good candidate for physical therapy, or do we need to send them to another healthcare provider?
Is this
Wow.
across the board, or is this specific to certain?
It's state by state, the direct access laws, but as of now, I'm pretty sure it's a very high percentage of states that have that direct access.
Okay.
So is it something that all medical insurances do, like accept for the most part?
Yes.
Wow. So if my knee hurts, I can just call you up and say I want to get some physical therapy for my knee.
Yep.
Wow.
I have a
Which
really
I think a lot of
dumb.
people don't know, and it's
Yeah.
hard because people don't know that. Yeah, and you get through the rigmarole of the healthcare system of, I have to go see my primary care doctor, and then they're going to order an x-ray, and then I'm going to come back and get the results of the x-ray, and then they might say I need an MRI, and then I'll have to wait for that to be approved by my insurance, and then 4 to 6 weeks later, then you're walking through the door of physical therapy and your pain is like way worse because you've actually gotten no attention to it. Even though you've been
Right.
seeing healthcare providers, you haven't been really receiving treatment for it.
Wow. Oh, this is so good. I'm so excited already. Go ahead, Kamna. What was your question?
No, I had a really dumb question.
Okay.
And I
love
think
it.
I've been explained this before, but I don't really get it. What's the difference between an occupational therapist and a physical therapist?
So a physical therapist, like our main goal is to help you reduce your pain, restore your function. So we're going to work on range of motion, your strength, your walking pattern, anything based on what your goals are. Physical
Okay.
therapy is very customized care. So people come in and they say, I have low back pain, but I want to pick on my grandchild. Great, that's what we'll work on. Or I want to go running, but I have knee pain. So great, that's what we're going to focus on. So we help with a lot of the range of motion, the strength building, and restoring that overall functional mobility. Occupational therapists focus a lot on your activities of daily living. So they're going to focus on things that help you, like brush your hair, brush your teeth, turn a
Okay.
key in the door. So like the biggest analogy I would say that makes people understand it is like a physical therapist is going to help you like stand up from the chair and walk to your bathroom. An OT is going to help you while you're in there brushing your teeth.
Got it.
Okay.
That's a really good
Okay.
explanation. Thank
Yeah,
you.
that's great. Okay. That makes so much sense.
So do you like specialize in a certain type of therapy, or do you do all kind of physical therapy?
So physical therapy is like a huge profession. There's physical therapists, mainly it's all musculoskeletal, a lot of neuromuscular. So helping people with just like generalized pain, helping people who have had strokes, helping people who might have Parkinson's disease. That's a large majority of it. But there's also physical therapists like me, for example. I'm certified as an impact trained physical therapist. So I work with people who have concussions and vestibular systems. So people who come to us that are dizzy, who have hit their head, things like that. There's pelvic floor physical therapy. So for people who are pregnant or for women who have just given birth, and helping rehab those pelvic floor muscles and rebuild that core strength and trunk strength so that they can move on, like carrying their child. There's physical therapy who specializes in geriatrics, like older adults. There's physical therapy who specializes in pediatrics, physical therapy in the school systems, helping kids access their school environment. So it's a huge world of people.
Okay, so silly question. Does physical therapy help with people who, like, let's say, fall and pee their pants?
Yeah.
Just, I'm asking for a friend. Wink, wink.
Yeah, absolutely. So physical therapy helps a lot of people who have trouble with their balance. So we work a lot on that balance control, building the strength, talking about all the components of the balance system. But yeah, a pelvic floor physical therapist would also help with that incontinence piece.
Okay. All right. That's a fancier word than pee your pants. Right. Okay, so what exactly does impact trained mean?
So it's a system, just like a certification course that you take.
Yeah.
So I got certified by that specific company, that specific brand. So it just goes through training people and knowing what to test for. So a lot of times when people come in with concussion or vestibular systems, they get headaches, they have dizziness, they have nausea, they have vomiting, they have tinnitus, which is a fancy word for ringing in the ears. They have blurry vision, double vision. So looking at how their eyes like move and track, how their cognitive status is when they come to see us. So just taking in all those components of like the mental health, the vision, crystals in our ear, like the vestibular system, and how that all plays a role with everything else of our physical health.
Okay. Wow.
So
Okay.
do you, sorry, go.
No, I had another silly question. People talk about these crystals in the air all the time. Like
Yes.
everybody who's ever been dizzy, crystals. As a doctor, can you see the crystals or are they just like quote unquote crystals? Like I don't understand this crystal thing.
So there's three canals in your ear that these like crystals sit in. They're technically just like little tiny balls, I guess you could call them in layman's terms, but they have to move in a certain way in those canals to make us feel like we're steady on our feet. So
Okay.
if one of those crystals or balls gets knocked loose out of its correct canal, that's what causes that dizziness or that feeling that we're going to fall over or the room is spinning around us.
Hmm.
So
Okay.
then we do what's called, there's different maneuvers that you can do. So you kind of move people around where they lay down, they roll over, they move their head around to relocate those crystals and make them not dizzy.
So is
Wow.
this typically what happens after a concussion, or could it be something else?
Yeah, it could be anything. A lot of times we see it after concussion, but we also get people who are just like, I'm really dizzy. And vestibular symptoms can come on from something as simple as like eating too much salt.
Oh,
Like we have patients who come and they've just consumed too much sodium and that can flare up their vestibular symptoms.
hmm. Interesting.
This is so involved. I had no
I
idea.
didn't either.
Yeah, physical therapy is like a giant, all encompassing healthcare
So
field.
how do you, okay, not to go down a rabbit hole, but we tend to do this. How do you know, like, if someone has had too much sodium? How do you figure that out?
So a lot of times it's a combination of us treating their symptoms of dizziness. So whether they get that dizzy in their head or dizzy spinning around the room, and then working with their healthcare provider to look at,
Mm.
why are they getting dizzy? So a lot of times they'll go first to like, we need to check their blood pressure. We need to check their heart rate, looking at those things first, that base level stuff. And if that's not causing those, then why are they getting that way? So then we talk a lot about their nutrition, their sleep habits, their posture habits at work.
Oh, posture plays a role in that?
They can, yeah.
Wow.
The part that I'm stuck on is that nutrition plays a role in all of this. I'm
Mhm.
a big proponent of eating clean and eating healthy, but I didn't know that it impacts things that would maybe cause you to need physical therapy.
Yeah, we talk a lot to our patients about nutrition. Um, like I said, the sodium with the vestibular is something that we see fairly regularly, actually. But we talk to patients a lot about their nutrition, just like anti-inflammatory foods, eating high-fat foods, and how that can affect your recovery from injury or muscle inflammation or swelling that you have after surgery.
Before you go on, can you
Oh,
talk a little bit about that?
yeah.
So we talk a lot to our patients about just eating good, nutritious, balanced diets. So we're not dietitians in any mean of the nature of the
Right.
day, but we talk to them about, anti-inflammatory foods. Like, do you eat blueberries? Do you eat spinach? Are you going to McDonald's when you leave our office every day? Because it's right down the road. So
Right.
what are you eating for that recovery portion? Because it's just as important as physical therapy when you're rehabbing something, just like if you would just be, trying to lose weight or trying to prepare for a half marathon or trying to just get healthier, that all plays a role because if we're eating high inflammatory foods or foods that are high in saturated fats, then our muscles can't recover, our joints can't recover. And then, we're kind of in this cycle of, okay, I'm doing the exercises, but I'm not getting better, but I'm going home and eating a cheeseburger and French fries and drinking 6 beers every night.
I like this seems like a duh moment for me, but I've never connected that dot that that would
I
be so
haven't either.
important. And when you said, "Are you leaving here going to get fast food?" Yeah, probably because I probably didn't have time to cook dinner because I'm getting PT and now I need to get something quick for dinner. And I'm not saying it's erasing the work I just did, but it's not helping.
It's not helping, right?
Wow.
And you said about fat, high fat, like saturated fat or good fats. What are you talking about?
Saturated fats. So
Okay.
we do talk a lot about, the good fats, like the avocados of the world. We love
Mhm.
those because we do need that to fuel our bodies because a lot of times when people come to physical therapy, they are exercising and moving a little bit more than they normally would. So we need those things to fuel our body to heal.
Hmm.
So people should be eating them to, and maybe this is an old wives' tale, but does it add like lubrication in the joints or
Yeah, it
is it,
absolutely does.
okay. All right.
Good job.
It seems like so silly, but I'm like, an anti-inflammatory food, like if you eat a cup of blueberries every day, it's going to help with the inflammation in your muscle and your joint and make things feel better.
Really?
I don't know why. We're both just really blown away right now. We're
I
just
know.
like, wow.
There's like so many components to physical therapy. I think people think like, oh, I have pain, I'm going to go there and I'm going to exercise.
Yeah.
But there's a lot to it. Like there's a huge educational component of, okay, yeah, we're going to exercise to help restore that motion and restore that strength and get rid of that pain. But also like, what are you doing day to day? Like, do you sit all day at work at a desk? Sitting is the new smoking. It's horrible for our posture, horrible for our spine. So is that like compounding a lot of forces on your body all day? Or are you always picking up your granddaughter in the same way and putting her on your left hip and always putting that left hip out? And is that what's causing your hip pain? And then we talk about sleep, your sleep postures. And if we're not sleeping well, sleeping at night is like our body's way of shutting down our computer. So if we're not getting good sleep, that's going to affect our recovery and our rehab too. So there's a huge educational component to all those other aspects of our health that people don't necessarily think of when we're thinking of our physical health and pain.
Wow. Okay, so if a person is getting physical therapy with you, what would you recommend them for sleeping to help with the
Recovery.
success of their physical
So we
therapy?
talk a lot about, that's like one of the first things we talk about. It's like the first visit with people is how well do you sleep? A lot of times people have pain and they're not sleeping well because of the pain. The pain will wake them up at night. So we talk to them about their sleep postures. Are you sleeping on your side? Are you sleeping on your back? Are you sleeping on your stomach? How many pillows do you use if you have neck pain? Are you using a pillow between your knees if you're having hip pain? So just different postures throughout the night, just really setting yourself up for good quality sleep. And then how long are you sleeping for? Because a lot of us, like, we work all day, we go to PT, we have kids, we have grandkids, we have families, we have to do this, we have to do that. And we kind of push sleep to the back burner. And we're like, oh, we'll be fine with 7 hours. Oh, we'll be fine with 6. Oh, we'll be fine with 5. But then days of that in a row can really lead up to our physical health deteriorating.
Okay, so let me back up for a second. So if somebody comes to you and they're like, well, no, I'm not sleeping good. My back hurts, my knee hurts, my leg hurts. You can help. Okay, well then let's figure out how to get comfortable to sleep. And maybe that is buying 6 pillows to put around you, and that is what you're recommending. Like, don't just say I don't sleep because I'm in pain. Like, let's figure out how to get you to sleep better is what you're.
Yeah. Finding that solution so you can sleep better, because that's a huge part of our recovery.
Gotcha.
That makes
So
sense.
smart. I need like 6 pillows to sleep, just saying. Absolutely. And you know what? I know this is a side note, but I actually take 2 body pillows and squeeze them in one pillowcase because I want it like bigger and fatter. Does that, you know what I mean? When that pillowcase comes off, it is so hard to get back on. But because I'm like that, like I notice a difference in my sleep if that pillow is flatter.
Yeah. And sometimes it's as simple as like, okay, let's like lay on our side and put a pillow under our arm, or let's add one extra pillow under our head for that extra support to put us in good alignment. But then that's like a great place to start, because if people start sleeping better, then they just feel better physically, they feel better mentally, and it kind of jumpstarts that rehab process.
This is also random. I'm sorry. This is how our whole interview is going to be, because we just keep thinking of random questions. But if you were recommending a pillow to a person,
Good
what
question.
kind of pillow would you recommend?
I have to say it's the same as the shoes. Like I said earlier, it's so different for everybody, because depending on where you're having pain and how the pain affects you, some people can't get comfortable to fall asleep at night. Some people fall asleep super easy, but are waking up in the middle of the night. So it just depends on your sleep diet and your habits, because sometimes people, depending on how we're built and how we're set up and how we're laying in bed, some people need one pillow between their legs to provide good alignment of the spine. Some people need 2. Some people need 1 under their head. Some people need 2. Some people want that full body pillow to, keep them straight the whole night. Whereas some people are like, I don't like that. I want, a little bit here, a little bit here to support. So it's different for everybody.
It's so normal. Like, everybody that is listening needs to know, like, go get some more pillows, try different things out, like get that sleep in. Okay. I've been telling everybody that forever and they don't listen to me, Caitlin. So thank you.
Yes.
Yes. She's been working on that for a long time.
I think people have to know too, that it's just customized. Like I said, with the shoes and the pillows. Now there's not a one size fits all for everything for healthcare. And your healthcare should be personalized to you based on what your goals are and how you're built and how you move.
That makes sense. That makes total sense, because I like a fat pillow, and people who visit, they're like, this is hurting my neck, and please give me a flat one.
Yep.
So, yeah.
Wow. Okay.
So
All right, go ahead.
We have a lot of clients who come to physical therapy. I was going to say come to you, but that's not true. Come to physical therapy and they're really all gung ho. They're doing really well where they thought they couldn't move that much. First of all, is there a physical therapist works with the person's limitations, I would assume.
Correct.
And then how do you encourage someone to do the exercises while they're there?
You mean
So
in the office?
Yeah.
Okay.
Like if a person thinks I can't move, I can't do that, it's not
Yeah,
possible.
good question. Yeah.
Well, one of the best things in the setting I work in an outpatient clinic. So people come here. So if they're showing up for their appointment, they're already showing initiative that they want to move and get better.
Okay.
So like the biggest barrier is kind of already out of the way. Like they're here and they're asking for help.
Okay.
The other thing is, I think the biggest like misconception about physical therapy and pain and movement is, oh, I have pain, I shouldn't move, because pain is telling our body that something is wrong. And it does mean, hey, we need some attention to this area, but it's not telling us that we shouldn't be moving. Movement is like the best medicine for our bodies. So even though it seems counterintuitive to like, I'm in pain, I'm just going to hold my arm and not move it at all, actually like getting it moving helps get rid of that discomfort quicker.
Okay.
Mm-hmm. So move it if it hurts.
Yeah. And we have a lot of working with different therapists throughout the years. I've heard a lot of different catchphrases, but there's, move it or lose it. When we rest, we rust. So there's just a lot of different things that, just trying to tell our patients in different ways, like we want to move. And yeah, we might have a little bit of discomfort when we move, or things might feel a little bit worse or a little bit more sore that day, but it's going to feel better the next day because we're getting things moving and we're telling our body that it's okay to move and we can do it in a pain-free way.
Okay.
Okay, so a person's physical ability before they come to physical therapy, it's not a limiting factor.
Not necessarily, because we're there to help with that limiting factor.
Okay.
So really, like I said before, it's a big part of that educational component of physical therapy. Like a lot of times people will come to us first and say, I can't move my arm. The doctor gave me this brace, or the doctor gave me this sling and told me not to move it and just rest and ice and not do anything. Then they come to us, we have to educate them, movement is the way to go. We have to get things moving. When we start moving, it helps make those muscles stronger, which is going to provide support to those joints. It's going to help lubricate those joints, so it does get easier to move. We're going to maintain the bone strength and integrity that we do have with our movement, because if we stop moving, then we'll start to lose strength. We'll start to lose that bone density. So it's just going to get us going in the right direction and give us that boost to improve things overall.
Wow.
The question, I mean, I think this is an obvious answer, but I want to hear what you think. So say I came to physical therapy, I did all my exercises, I started feeling better, I'm doing the things recommended to me at home, and now my 6, 8, 10 sessions of physical therapy are over. And then I sort of don't have that direction to do physical therapy. What is the impact of stopping the exercises at home?
Yeah, so a lot of times people just stop the exercises because they're like, oh, I feel better. That's it. But it takes time and work for those things to feel better. So I think people always want that quick fix. They want to get in, get it fixed. Like, I went twice, I feel better. Great, I'm done. But we can't necessarily build strength per se in 2 visits. Like it takes time to make those physiological changes in our body to build that strength and gain that range of motion and maintain it. So just sticking with those exercises after you've finished therapy, which again is another huge component of that education that we play a role in when we're treating people. You need to stick with your home exercise program, or a lot of them have a goal of getting to a different exercise program, whether it's strength training, or they want to go back to yoga class, or they want to get back to running. So just easing them back into that exercise program at home of things that they enjoy. That's one of the biggest barriers, I think, is people are like, oh, I have to go to physical therapy and I have to ride this bike and do squats, and I hate it because I don't like to do that. So it's finding what people enjoy. Like if you enjoy yoga, that's great movement. If you enjoy walking, that's great movement. If you enjoy Pilates, boxing, racquetball, whatever it is, we're going to work and try to incorporate things that you like to do so that it's easy to do.
Oh, that's
what is the biggest success story that you can remember that you've had?
Oh, Did you put her on the
Oh,
spot with that one?
that's a hard question.
Okay, sorry, you don't have to answer that.
You can think about
I
it.
would I wouldn't say I have like one big success story, but I think physical therapy overall is just so rewarding. Like day after day, patients come in and say like it could be like the simplest thing, like I was able to drive the 15 minutes here without my back hurting. Like,
Oh,
great,
yeah.
that's amazing
Wow.
progress.
Yeah.
Or it's, they come in and say, I was able to kneel down on the ground to play with my grandchildren over the weekend at the family cookout. Or it's people come in and it's monumental things like I was able to do my triathlon. So
Yeah.
it's all of those, not poo-pooing per se anybody's goals because it's just as important to like, I want to just be able to stand for an hour in church or I want to go do this crazy athletic event. So
Mm-hmm.
everybody's goals are so important. So just hearing when people come in and they say, I was able to do this, and they come in so excited to tell you that, like that's the biggest success story. Is just every day hearing people so excited that they're getting better and they're not having pain and they can do what they want to do.
So for you, it's pretty important to ask at that first visit, like, what is your end goal?
Yeah,
That's an
that's
important
something we
question
always
for you.
talk about that first visit. Like, tell us about why you're here, like what's going on with your shoulder or your knee or your back. Tell us about how it feels. Tell us about how it started. But then at the end, yeah, like ultimately, what are your goals from physical therapy? Because I can see, like, yes, you have limitations in your mobility. I can see that you've had a decrease in your strength. You're telling me that you have pain. So my goal is to improve all of those things. But at the end of the day, what is the thing that matters to you that's going to make us be able to achieve all of those things?
Well,
So do you
yeah,
want to be able to sit for an hour at work? Do you want to be able to sit in the car and drive 3 hours to go visit your family? Do you want to be able to, bend over and pick
right.
up groceries off the floor?
So why do
So
you
it's
think
what
it is hard for people to do it at home?
I just think, you know, everybody is in this like hustle culture of America per se. We go to work, we go home, we have kids, we have grandkids, we have to cook, we have to clean, we have to drive here. A lot of people have long commutes for work. So we just get into this culture of we have to do all these things and work so hard, and then we push self-care and sacrifice self-care
Oh,
because
so do you consider PT self-care?
absolutely.
Oh, okay.
Yeah. Movement and healthcare is self-care. But people say, I think it's hard too because people, when they think of exercise, they're like, I have to dedicate 30 minutes, like a giant 30-minute block a day to exercise, or I
Right.
have to go out and run for an hour. Like, you don't have to do that. It could be as simple as you're standing at the sink doing dishes and you do 10 squats when you do it. Just any intentional movement is going to be healthy for us. So I
Mm-hmm.
think it's just starting to build that and then putting it into our routine, whether it's, small 5-minute snippets a day, or you want to go out and exercise for 30 minutes.
Yeah.
Um, but I think home is hard too because people, they go to work all day, they just want to go home. And
Yeah.
home is a hard environment to exercise or do your therapy in per se because it's a location we're familiar with. So, we start exercising and we're like, oh, I should really just go fold the laundry, or oh, it's, I've done 10 minutes, that's good enough. I should go cook dinner. So even if it's just getting out and going to a trail and going for a walk or going to the gym or just even going out to your garage so you're not in your house around your household chores, something as
Mm-hmm.
simple as that. And I think too, a big thing is when it's at home, it's easy to just push it off because we're by ourselves.
Right.
So I always tell people the biggest thing is like make it a community event. Like meet your friend once a week for a walk, or meet your friend at Orange Theory or CrossFit or whatever you guys like to do once a week. Even if you start with just one time a week, building it into your routine and making it a habit makes you want to do it more.
Mm.
How do you think having the physical activity in a person's life impacts their aging?
Mm.
So there's actually a stat that I looked up before this podcast. There's a lot of movement stats and facts and all that, but it says for every 1,000 steps over 4,000 steps a day, that reduces your risk of dying early by 15%. So even something as simple as walking helps reduce that risk of dying early and just helping you age well.
So
Because if
for
we're getting that
every,
movement every day, go ahead,
I want to go back to the statistic. For every
yeah,
1,000 steps,
over 4,000 steps a day,
Over 4,000.
okay,
that
so
reduces your risk of dying early by 15%.
the
Wow.
base is 4,000, and then every
Yes.
1,000 steps you add, it reduces your risk of dying early by 15%.
Yes.
Wow.
That's a staggering number. That doesn't seem like a lot, a
No,
1,000 steps to do.
and I'm so glad you said that because everybody else hears 10,000, 10,000, 10,000, And I like that you're saying it's 4,000 because there are some people that are like, okay, I can do
10,000 is a lot of steps. I mean, the average per se is 2,000 steps is a mile. So 10,000 steps a day is 5 miles. So if you think about when we're sitting at work, sitting in our car, doing things at home, like 5 miles a day is like a staggering amount. And it's like very overwhelming to people.
Yeah, it
But you would
is.
also be surprised how many people we see on a daily basis that aren't even getting 4,000 steps a day.
Okay. Yeah, I'm sure.
Right.
Yeah.
Wow.
But that's why I like that number, because I feel like that seems so much more manageable.
Right.
It's a lot. And for some
It's
people, it's
still a
like
lot.
amazingly unbelievable, like 4,000, but like it makes me feel good to know that 4,000 you and we can get you there. Do you feel that
Yes.
way? Like we can
Yeah.
get you there. We
And
can get
we've done that with people. Like we've used activity trackers or Apple
yeah.
Watches or Fitbits. Like, tell me how many steps you've walked today. Keep a log over the next week and we'll talk about it next week. What was our average per day? Are there days that you're walking more? Why are those days better than other days? So just figuring it out of, just general walking. Like walking is one of the best exercises we can do. And people are like, oh, I walk all day. But do we like actually?
Right.
Right.
Wow.
I want to ask you a question, and maybe you don't know the answer to this, but I'm going to ask you anyway because you're so smart. I feel like you will. Um, what do you think about the connection between movement, particularly physical therapy, but movement and weight gain and health specifically?
Yeah, so there is a lot of research on just movement in general and weight loss or weight gain or weight management. There's a lot of research on just how carrying extra weight affects our joints and muscles of our body. They say that even if we're like 10 pounds overweight, that can increase the stress on our joints by 4 times.
Wow.
Mm.
So there's a huge impact of our weight on how our bodies move. But like I said, it's something as simple as just getting people moving and getting them walking a little bit. Sometimes people don't realize how inactive they are until they come to people and start talking about it, or they don't realize how poor their movement is until they come to a physical therapist and realize how to move properly.
Mm-hmm. Yeah.
What if someone is in a lot of pain and they're like, I can't do it. I can't walk. I can't move. It hurts too much.
Yeah, so there's a lot of ways that we can get people moving. We have like a full gym in our physical therapy office. So sometimes people will say, it hurts my knees too much to walk. Okay, great. Let's like get on this bicycle and try that because it's just continuous movement of those knees that we're getting without that weight bearing component of walking.
Mm.
Okay.
Or sometimes we start as simple as like, we're going to lay down on our back and our side and just do movement with our legs that way. Like you don't even
Oh,
have to be standing to do exercise necessarily, which some people think. We can lay on our stomach, our back, our side, and move people through different movements that way to start moving through that pain-free range. And then once the body makes that connection with the mind, like, oh, we can move in a pain-free way. Okay, great. Now we're going to do the same thing, but standing up to add that weight-bearing component.
that sounds so amazing to me. Like a no-brainer again. Like, okay, let's lay down and do this and then get it going, do it a bunch of times and then move. Wow.
Do you, in your office, do you use free weights or machines that or have weights?
So we have a little bit of everything. We have a lot of bikes, we have treadmills, ellipticals, rowers, we have free weights, we have bands, we have weight racks. So a little bit of everything. We talk a lot to patients about what they enjoy and what their best follow through will be at home. Like
Oh,
a lot
good
of people have
question.
a home gym with weights. So when we focus on your plan of care here, we're going to use weights because we know it'll be easy to follow through with at home because you have weights at home. A lot of
Okay.
people have bands at home. Some people don't have any equipment at home and we're like, okay, great. This is like the cheapest option then for you to start a little home gym.
Mhm.
Or we offer a 24/7 gym at our office. So if
Oh,
people aren't going to do it at home and they want the accountability of going somewhere or just being under the supervision of us while we're open, they can join our gym at our office and come in outside of their physical therapy appointments to exercise.
mm.
Interesting.
Okay. Change the topic real quick because I wrote this down and I don't want to forget to ask you. What the heck does running gait analyst mean?
So that means we do a video analysis of people's running pattern or their walking pattern. So we'll either get them on a treadmill in our office or take them outside. We take a video of how they're moving with that running, and then we analyze it. So we look at where are their joint forces? Like, do they run and hit their heel first on the ground, or do they run and hit their foot toe first on the ground? Are they swinging their arms? Are they rotating their body? Are they, moving their hips up and down a lot? So looking at all the joint angles and forces and components, and then figuring out why you're not moving efficiently or how you're moving that could be causing your pain.
And then you work on like the walking to correct that.
Yep, walking or running to correct that, and giving exercises to either help with motion of some things or help with the strength of some things or the stability of some things to help better support that overall movement pattern.
I feel like I want you to analyze whatever me,
Analyze. Yeah.
analyze me just to see what I do wrong or right or
Yeah, so that's another common misconception too about physical therapy. People think like you have to have pain or you have to have been injured or you
Oh.
have to have surgery. But we do a lot of preventative care as well. Like you don't have to have pain to come see us. If you're just training for a half marathon or training to run and you want to be more efficient and know if you're doing a good job so you don't get hurt while doing it, we'll analyze people ahead of time and say like, okay, this could cause trouble down the line, so we're going to fix it now.
or if like I want to someday start running, come to
Mhm.
you and okay, is that something that and you might not know the answer to this? Is that something that typical insurances would cover or not because it's not medically necessary at that point?
So that's the hard part is with
Yeah.
a lot of that preventative type care, your health insurance won't pay for it because
Yeah.
unfortunately our health insurance focuses on like this sick care and prescriptions and
Yeah.
rehab. So it's hard to get them to cover that preventative type maintenance, even though, if you came in one time and got analyzed for your gait and it cost you, or it cost the insurance company $100, and you come back for a follow up, we do one follow up, we give you a few exercises, things to work on with your running program. You've only spent 2 visits at our office. Whereas if you hurt yourself down the line running,
Yeah.
it's 12, 14, however many visits, and that's costing you more healthcare dollars.
So true.
So, do you use this to help you with your running specifically?
I have. I was like my own guinea pig when I was going through the course.
How
What did
cool.
you learn that you can share with us?
Yeah.
So I learned a lot about my pattern. I'm what they call an overstrider. So I
Oh,
take very big steps when I'm running and I'm not keeping my base of support underneath of me. So then it could cause hip pain or injury to my knee because of the loading force. So I worked on increasing what you would call your cadence or how many steps per minute you're taking to help shorten that stride and move my feet a little bit quicker, keep those feet underneath of me and decrease that joint stress while you're running the pavement per se.
so did you count? Like, did you actually practice by counting how many steps in a minute?
So the video analysis software we uses does a lot of like the counting for us and helps us
Yeah.
measure the angles. And then anytime with today's day and age and technology, if you wear a Fitbit or an Apple Watch or anything, it'll track your
Oh,
cadence while
that's
you're
true.
running.
Okay.
And does it, I've heard when you run, you should be coming down with your whole foot, or I I forget, is there a
So
thing
that
that's,
depends too on what your goal
oh,
is and what
Oh,
distance you're running. Um, so a lot
oh.
of times if you're like sprinting, just like a very short distance, you want to stay up on your toes because you're going to get like a forward lean of your body and get that good momentum and those fast twitch muscle fibers going. Whereas if you're running a longer distance, like a 5K or a half marathon, you want to strike more of like that midfoot or the heel.
What about just walking? Is there a certain way we should just be walking?
Most of the time for walking, it's just that heel strike. And the biggest thing is like striking with our heel, then rolling through our whole foot and pushing off through our toes to get that forward movement.
Huh.
okay, I have another random question. So a lot of women, particularly my age, not Leah's age yet, and not definitely not yours, have plantar fasciitis.
Yes.
Is there something you could recommend that they do?
So there's a lot of things to do for plantar fasciitis. A lot of it comes down to just our foot posture at the end of the day. So how we stand, how our weight is distributed on our foot, how we're walking, and then how we're doing any sort of exercise we're participating in. But a lot of things when it comes to it, in physical therapy, we use a modality called ultrasound, which uses sound waves to get into that plantar fascia to break up any adhesions or anything that's building up in there. We use massage, then we teach people exercises, stretches to help stretch out that plantar fascia. Then we teach them strengthening exercises to help strengthen the Achilles and the calf muscle to help support that plantar fascia. So there's a lot of components that go into it.
Mm,
Oh, that's
okay.
good to know because I think a lot of women think they just have to deal with it.
Right. Okay.
Yeah, and I think a lot of people think they just have to deal with pain in general. But like I
Right.
said, that's something where they have it. They could call their physical therapist directly, come in, get some exercises, get a few treatments, and then be on their way.
So you don't have to go to the doctor first. You can just call you and say, my plantar fascia is hurting.
Yeah.
Good thing I know this now. Wow.
Yeah, because eventually you'll
Tell
need
your
to know
friends.
this.
Well, I feel like my knee, I mean, literally my knee has been killing me, and I'm like, I don't want to go to the doctor and schedule that appointment and then another appointment, and I'm like, okay, maybe I don't need to.
Yeah. Call your physical therapist.
Wow.
If you had to give one takeaway for people to know about physical therapy or movement or something, what would it be?
I think the biggest thing is just movement is medicine. Don't be scared of movement. Our bodies were built to move.
Mhm.
Mhm.
Our pain is telling us that something needs attention, but it's not telling us to stop moving.
Oh, I like that. You know?
That's really good.
Okay, I have another question. Do you recommend heat or ice?
It depends on the situation.
Okay.
Like I said, physical therapy is such customized care. Like there's no like one size fits all or one answer is best for everything. Depending on how long their pain has been bothering them, depending on where their pain is located, depending on how their pain is presenting, depends on which one of those is going to help better.
Okay. So there's not like well, let's say I don't know what to do. Will one hurt it?
Neither one is going to hurt.
Okay.
And our
Let's
body,
say someone has a fall, then.
Then would you put ice or?
you know what though? Sometimes ice helps because we've like bumped something and we have bruises, but sometimes heat helps because when we're going through a fall, all of our muscles tighten up. So things get very tight and tense, and
Ah,
heat helps relax those muscles. So, like I
Mm,
said, it's very situation dependent,
yeah.
and
mhm.
there's no one best answer. And our bodies are very smart in the fact that they're going to tell us, like I said, they send us pain signals to tell us something is wrong. If something is helping and making us feel better, it's going to let us know that too.
That's true. That's fair. I know that feeling. Like sometimes when you put cold on something, you're like, this does not help.
Right.
Like it's yeah. Wow.
Our bodies are intuitive to what we're doing.
I think I said wow 50 times on this episode.
We should have
Seriously.
done a count.
It could have been a drinking episode, or if somebody did a shot, everything Leah said, wow.
They're not listening anymore.
I know.
Well, thank you so much for your time. It really has been fascinating, and I think it's going to be really helpful to people. I know it's been helpful to me for sure.
Oh my gosh, I've learned so much. And I feel like I have more questions for you. I don't think
Yeah,
I even
I'm so
tapped them
happy
all.
that you guys asked me to be on the show and just share with everybody what physical therapy is all about, because I think there's a lot of misconceptions about physical therapy, and there's a lot of things people just don't know. Like they come to us for their first visit and they're like, I really don't even know what we're going to do.
Right.
So I think it's good to get that out there and just know people can come to us first as well.
Yeah, that's so important to know.
Absolutely.
So,
Well,
well,
thank you
thank
so
you
much.
so much.
Of course. Thank you for having me.